Yep, it's that time of year again. June is Men's Health Month. Now, fellas, before you post that selfie from the gym where you flexing in the mirror after a good pump or before you buy the next pair of J's, have you talked to your doctor lately? Do you know your numbers? If you don't, let's talk about it. We're going to talk about the 5 numbers that men need to know when it comes to their health. Let's talk about it, y'all. Let's be real. For all the sports fans, the fellas that really follow sports closely, too many of us know the stats of all our favorite players in the league. But when was the last time, again, you checked any of your numbers? Huh? Blood pressure, blood sugar, prostate, your weight. Yeah, have you checked any of those numbers? Yeah, we don't know any of those numbers, but we know what our favorite player doing. Yeah, most numbers that men know: shoe size, hat size, waist size. Sometimes they guess at that because they wear those pants with the elastic waist in them. And maybe even your zodiac sign because of that last crazy ex you was dealing with. But most don't even know what their recent A1C is if it walked up and slapped them in the face with a Caesar salad. Yeah, you know it. So let me help you out, men. There are 5 health numbers that we all as grown men need to know, because what you don't know can literally hurt you. Yep, the silent killer, blood pressure. This is where it's so important that you know your numbers, because it can save your life. And if you don't know your numbers, that's how you lose your life prematurely. Not sure where you stand with your blood pressure? Please pause and take a screenshot of this. And know that if you over 130/80, you got pressure, but not the kind of pressure that gets you promoted. At least not here on earth. You'll be promoted somewhere else outside of this place. You don't need WebMD to freak out while you're trying to answer all them questions of the symptoms that you think you having. Because if you hadn't been to the doctor in a little while and you worried and you on Google, being a Googleologist, just going to see the doctor and having some blood work can freak you out just the same. I would encourage you to pause this and take a look at this. HDL, LDL, and triglycerides too high and your arteries are looking like a clogged drain at the barbershop. That's not a good look. And if your car get more checkups than you do, then we got a problem, because we have a severe case of diabetes in this world. You know that auntie got diabetes, your mama got diabetes, your dad got diabetes, and all your damn siblings got diabetes, but somehow miraculously, you don't have it because you have a severe case of diabetes. I would encourage you to pause this and take a picture or a screenshot of this so you'll know where you stand when it comes to normal, pre-diabetes, and diabetes, y'all. Yeah, it's self-explanatory. BMI. Yeah, the scale can lie from time to time because sometimes we squint and see numbers that ain't even really there. But I tell you what don't lie, that belly fat. And if your waist is larger than 40 inches, yeah, that's not a fashion statement. That is a health risk that you need to address. Feel free to pause, take a picture, screenshot of this for the record. Prostate-specific antigen. We need to talk about it, y'all. PSA about the PSA. But for men, manhood is not how much pain you can hide. It's how well you protect your peace and your body by seeing your doctor on a regular basis. And men, just in case you didn't know, you need to talk with your doctor and assess your risk factors before having this test done, because it comes with a lot of things that we need to consider. Okay? Now, men, if you are over 40 and you have a strong family history of this, you need to have a good relationship with your doctor if you have one. If you don't, you need to get one. And be seen, get screened if you have risk factors, because you want to make sure you're screening this appropriately. Because I don't care how strong and well you think you are, it will not protect you from prostate cancer if you have significant risk. So kings, let's normalize knowing our numbers by going to the doctor on a regular basis and not just sitting in the corner of the barbershop talking shit. We can't break generational curses if we ignore generational health risks. Be seen, get screened. It could literally save your life. Stay tuned. All this month, we're going to be talking about men's health, y'all. Hope y'all enjoyed this one. See you soon. Peace and blessings.